it's like those relapses though, like some of those setbacks, like they would actually tear me apart. Like I would be, like the pain inside would be really, really, really bad.
You either choose to stay how you are or you choose to change, and that's all it is.
I'm not gonna lie, like this is gonna probably upset a few people, but here we are.
Brace yourselves, guys. Strap in.
I do believe that some people actually want to stay in this problem. Hello and welcome to the Finally Quit Porn podcast. Today we're back in the studio for another episode with Jess Waller. Welcome on the show, Jess. How are you doing today?
Hi, thank you. Yeah, I'm doing good. Excited to be here. Looking forward to it.
Yeah, awesome. Thanks very much for coming on the podcast.
Welcome.
Do you want to start off by introducing yourself a little bit? Tell us what you do at the moment and how you got into it as well.
Yeah. So I am a trained psychotherapist. I've been a psychotherapist for almost 5 years now, and I work in the field of addiction, hence why I'm here. And yeah, I work privately, and I have worked all across Europe. I currently work as a therapist, living companion for a rehab in Switzerland. Mm-hmm. So I'm doing a lot of traveling.
Yeah, you are. Even in England this week, you were saying earlier. So how did you get into addiction recovery?
To be honest, it was just a complete sort of whim. When I was studying, so I had to do like a placement, and I did a placement with Macmillan and I did a placement with a high school. And then when I qualified, I was looking for jobs and kind of seeing what was out there, and a job had come up at a rehab in Northwich. And I was like, oh, like addiction, like I've not really done that, but I'm quite interested in that field. I find it quite fascinating. So I applied and ended up obviously getting a job, and it was great. And it kind of opened up my eyes a lot, because I'm not a person who is in recovery for any kind of substance. I will say that I had a very naive sort of tunneled vision view of what somebody in recovery or active addiction kind of looked like and sort of portrayed themselves as.
What was that?
So my initial thought was like, oh, like you've got no job, like your life is ruined, like if you've been taking like crack cocaine or heroin, you might have no teeth, or like you're homeless. Like that was my serious sort of tunnel vision view of what I was going into. And I think as a society, that's quite a common misconception. You might see homeless people on the street, or back in Stoke, there's a huge like monkey dust pandemic, and you can go out and see people on that drug, and it is usually homeless people because it's quite cheap to get. And there is that sort of what I've just described that is very apparent there. But going into the field, it was like, oh, hang on a minute, like anyone can be addicted to anything at any one time, and it doesn't matter. It's not, it's not judgy. You can get anyone. So it was quite, I was quite naive when I went into it, really.
And how long have you been working in it now?
Just coming up to about 5 years.
Yeah. How's it been?
Yeah, I love it. I think it's really great work. It's really like fulfilling from both sides, because you are sort of, especially when I was working in the rehab in Northwich, because that was a group setting, you would work with sort of maybe 20 people at a time. And like it was nice to see like them all sort of getting a sense of self, but also getting a sense of understanding from other people. Because I think, within addiction, it can keep very isolated, and you think it's only you, and, oh, nobody else is going through this, and it's just me, and like I can't tell anybody because it's this huge thing. When actually then you step inside rehab and it's like, oh, hang on a minute. There's not only people who are maybe detoxing at the same time as me, but there are also people who are working who have also been where I am. Yeah. And it can be a really life-changing thing to be a part of. And I think that is this type of thing that I wanted to go into when I decided to be a therapist, is that I wanted something that was sort of life-changing, that was quite motivational, or there was a clear sort of, like, this is amazing. Which again, might be a bit naive, because it doesn't always last. And especially in the world of addiction, you know, people relapse all the time. So yeah, I think it's been good sort of professionally and also personally.
Yeah. I think that group aspect of it is really important. As you said earlier, you know, there's a lot of misconceptions around what an addict looks like as such. And I think that's one of the reasons why I've tried to be very like honest and open and vulnerable at times in my sort of, not journey, but just as kind of like, just my life, I suppose, when it comes to quitting porn, because, you know, you got like, just, I don't know. I think there's a bit of a misconception that people who have a porn addiction are like this big, sort of overweight, like weird person who plays video games all the time, just laying down, creepy, really creepy. Yeah, and I think that's kind of what TV does in the media, but I think your average person who's addicted to porn is like just your average person, like you see out and about. And actually, I mean, I'm not saying this is necessarily true, but I think because there is a bit of a culture online of, right, self-improvement, part of self-improvement's quitting porn, a lot of guys who go and try and quit porn are actually the sort of people who are interested in self-improvement and are really into that world already. So like a lot of the people that I work with are kind of going to the gym all the time or in really good like shape, maybe got good jobs, very driven. And yeah, it's just been quite interesting to realise that actually there isn't like any definition or real look of what an addict is. I remember like about a year or two ago, I was out with a close friend called Harriet, and I'd actually just had a relapse. I was feeling really bad, and we was on a walk and we were talking about porn addiction a little bit, and I was just like saying to her about how I felt and stuff, and I can't really remember how it came up, but yeah, she was really shocked when I told her what I thought people would perceive a porn addict to be like, because she actually was like, oh, well, anyone can be a porn addict, you know, I wouldn't see them in that light. I used to be on this app called Brain Buddy, and it kind of got you to imagine like Voldemort being like your addiction or something. And so it kind of gave me this idea that if I'm addicted to porn, I'm like Voldemort, which probably isn't the best. So,
yeah, it's like monkey on your shoulder and all of those like analogies. But what I found, because obviously, as I said earlier, like when I was driving up, I was listening to Jason's episode, and it was what came to light for me was like the label of it. Like I know for me, when I was going through sort of my mental health issues, I craved a label. I really wanted a label, but I wanted the right label. And that's obviously my personal experience. But as I kind of went through life and did my training, I realised that actually a label can be quite detrimental to people. You know, when I was doing my training, we had like a whole lecture on labels and diagnosing and how detrimental that can be to a person. Wow. And it kind of was like, oh yeah, actually, like, because once you've got a diagnosis, especially maybe, you know, a psychotic diagnosis like bipolar or schizophrenia, and also I'm an addict, you are then immediately stereotyped and immediately put into a bit of a box of like, oh, that person can't be trusted, or I don't want to be around that person, or that person can't have fun. Like, so I do think with labels, like they do stick with you for a really long time because of that sort of stereotype, and people don't want them, you know, which kind of leads on to the whole, are you an addict or are you just a person who had an issue with whatever it was, porn, sex, food, alcohol, drugs, like everybody has something, in my opinion.
Yeah, it's a tough one, and I totally agree about like the labelling. I think it's a big problem that we have nowadays, just in general across like the board of mental health, of labels, and a lot of people wanting to get a diagnosis. So I think it can help some people and with some conditions. But yeah, with the addiction one, the problem for me with that is, in my opinion, it's just something that is 100% reversible. So it's like, you're not an addict. You're not defined by this one sort of habit that you have. What's going on is you have addicted neural pathways that can be changed because the brain's plastic, and that's all there is to it. But it's really hard to kind of get out the cycle of like, is there something wrong with me? And that feeling of shame, which which no amount of intellect can really overcome. I think from my experience of life, the best way to overcome the shame of, oh, I had a relapse like 2 weeks ago, or whenever it is like, the only way to overcome that is to actually go a longer period of time without having a relapse. And that might sound a little bit different to what most people would say. Most people would be like, well, you know, just try and let go of the shame, or meditate, or do something else. But in my opinion, the best way to like let go of the shame and that pain is to just actually prove to yourself, you know, I can quit this, and go and quit it. Sometimes that can be difficult.
Yeah. And I guess it, you know, like it depends on how you view what shame is for you. Because like guilt is I've done something wrong, but shame is I am wrong.
Yeah.
And I think that is a really key part of understanding yourself, because you can feel guilt about something or think that it's guilt and actually it's shame. And I think you can say, okay, I've relapsed and I feel guilty for that because I've done something wrong, but I don't feel like I'm a wrong person for that.
Yeah.
So the shame is sort of diminished because it's just the guilt, and that I find that guilt can be easier to overcome than shame, because shame is about how you view yourself as a person and how you view yourself in this world. So I am not worthy, I'm wrong, I am whatever. Like, so I think, because when I used to work in Northwich, there was a whole group on like guilt and shame and the difference in it, and it was a bit of a minefield to kind of first get your head around. But yeah, like having that differentiation between, you know, guilt is I've done something wrong and shame is I am wrong, then it kind of opened up people's minds to be like, oh, okay, hang on. Now I can start to look at my life and my wrongdoings like slightly differently and sort of compartmentalize what it all is, you know?
I think the big thing there is like, you realise that there is hope and that you can quit as well, because it's a lot nicer to know that there's like absolutely nothing wrong with you and there's just one behaviour that you want to quit, or there may be multiple, because actually we often find that with compulsion it's more than one, but you know, it's just a behaviour, it's not you, there's nothing like inherently intrinsically fundamentally wrong with you. And yeah, I think just a recommendation, I guess, is to read Brené Brown if you want to understand the distinction between guilt and shame more, because that's where I learned what you were just talking about from as well, and her work was pretty good. So in terms of quitting, what kind of, I'm sure there's quite a lot, but what kind of techniques or tools do you use to help people quit?
I mean, for me, it kind of depends on the individual. So I am a strong believer that no one size fits all, and I will adapt how I work to sort of fit that person. But I guess sort of foundationally, if you were a client that came to me, I'm quite a big believer in taking you back. So I ask all of my clients to do a timeline. We joke and call it a trauma timeline, but it's kind of all these significant events that have happened to you from your earliest memory up until now. And obviously, depending on who you are, that might be a short list, it might be a long list. And I do reassure people, you know, don't worry, like this is not... I'm not going to judge you for how many pages that you've got. You know, I had a client that had 10 pages that were back to back. So, you know, it was a long little read for me. But I ask clients to do that, which not only helps the client, but it also helps me. Because a lot of the time, people will come in, regardless of if you have an addiction or not, this is kind of generic, but you come to therapy and you're like, okay, where do I start? And you're quite scrambled in your head and quite chaotic, and you can kind of bounce around, and it's quite difficult to sort of have order. So it helps a client to sort of order their life and go, okay, like this is sort of what's happened. And it helps me to kind of get an overview. So especially within addiction, it was quite common that you would get sort of quite adverse childhood experiences, ACEs for short, that then you could be like, oh, okay, maybe this led to some of this. And ultimately what it highlights is patterns of behaviour, not necessarily to do with a substance, but to do with, okay, this event happened and you reacted like this, then this event happened and you reacted in the same way, maybe worse, maybe slightly differently, but the pattern is the same. So a lot of the time with sort of addiction patients, addicts, recovering addicts, whatever, it would be they maybe started drinking at a really early age, and then they don't drink for years because, you know, they were 13, let's just say. Then they don't drink until they're 18. And then they start drinking at 18, and it's like, cool, okay, you've got about 5 years now of sort of what am I trying to say? Accelerated drinking, and it's kind of getting worse. And then they might not drink for a while, they might be sober for a year because they might get into a relationship and they feel like their life is fulfilled. And then that relationship ends and they go back. So that's the pattern of behaviour. And I worked with a guy called Dr. Terry Spokes. He was great. And he's worked in this field for ages. He now works in Singapore. But he used to say to me, remove the substance and what you're left with. And that was how he sort of worked with clients. Okay, we've removed the substance, but what are we left with? And so it might be crippling anxiety, might be shame, might be guilt, might be grief, might be trauma. And then once you've kind of got that pattern and you've removed the substance and you can see it, then you can kind of start to do that deeper work of like, okay, I can see that you've got a pattern of trauma in your childhood. Like, let's talk about that. And how has it affected you now? And then a lot of the time clients will be like, oh, well, I don't need to talk about that because I'm over it. It's fine. It happened. Logical brain, you know. Oh, it was so long ago. I've made peace with that. But we're still in this cycle of drinking or using or whatever. And it's, yeah, does that make sense?
Yeah, it makes sense. If there's someone listening to this and they wanted to map out their own sort of childhood experiences, do you have like any advice on how to go about doing that for themselves?
Yeah, with care. Like it can be like reliving the trauma all over again. And that can be really dangerous for you as an individual, depending on where your mental state is or even isn't, and it might just bring stuff back up and you've kind of dropped off a cliff again. Make sure that you have sort of support network, maybe do it with somebody, professional, mentor, friend, whoever, and take your time. Like if you're doing it, like I give clients time, you know, I might only see clients weekly. I'm like, don't worry if you've not done it for next week, like it's absolutely fine.
So would it be like the key events in their life and then associating that with when they started engaging in whatever compulsive behaviour it is?
I mean, that would be a key event. So it's trying to not focus all of the work on just removing that substance. You can remove a substance. You can go to the NHS and get a 10-day detox. Done. Substance removed. It's what you're left with. I always call it Pandora's box. You've just opened it. What are we going to do now? Well, people, you know, it's chaotic because you are filling a void with your substance or your behaviour. You have a void, you're filling it. What is that void? You can remove your substances as many times as you want. But if you've not fixed what the deep stuff is, or not even fix it, if you've not understood it, then you're always going to revert back to that pattern, which becomes very apparent when you do the timeline, because they always end up going back. And it might be over 20 years, you might have had just five years of chunks, 5 years, 10 years ago, 5 years now, of really, really chaotic drinking, let's just say. But why? Why did you have maybe 10 years of sobriety and then you pick up again?
What if I'm going to play devil's advocate bit here? I don't hit you some hard questions. Hope you're ready. So what if there is no real void and there isn't any real reason, there's no why behind the desire? All it is let's say you got into porn's addictive, changes your brain, now you want to look at it more. Other than that, life's all right.
I can't say that I've ever had that. Because it doesn't, there will be something, and it might be the tiniest thing that is just planting a seed of low self-worth. Might be a kid called you a name in high school. And that was like, 10, 15 years ago. But that seed has grown with every other event, a girl not going out with you, for example. I mean, I'm saying girl, I don't know if you're gay or straight, but whatever. So something has happened and that seed's grown a bit more and a bit more and a bit more and a bit more. There is something in the behaviour, in my opinion, something in the behaviour that you have become addicted to that's filling something within you that you're missing. And that might not be anything traumatic, but it is still something. It might be joy. It might just be the only way that your head can switch off. But why is that the only way that your head can switch off? When everybody else in the world, your friends, your family, whatever, don't have that, why are you picking that?
Okay, on that point, I've got another question. I'm going to keep challenging. So, would you agree that like most people, or in fact everyone, has a problem in their life? Like there's something there. Maybe it's some kind of trauma. They've been through something hard, but there's a problem in everybody's life in one way or another. Not that there's anything wrong with them, but there's always problems. Like everyone's got stuff that they could work on further. Would you agree with that?
Yeah.
Okay. So if you agree with that, and then there's always stuff to work on, how come some people are addicted and some people aren't? Because if you took the addiction away and we were just to work with a normal sample of the population, if they all have problems that could be worked on further, how is it that solving those problems is necessarily going to solve the addiction? Because everyone always has problems, right?
So,
because could you not just
and
then the addiction doesn't necessarily go?
I think it depends on what you... Okay, so for example, if you decide that alcohol is your coping mechanism and you become addicted, you can't just stop that. You need a detox. So then it becomes a bigger thing because you need a detox, and then there's still those things going on. For me, I'm not addicted to any kind of substances whatsoever, but I've had coping mechanisms that I've had to go to therapy for. Everybody does. For me, it was skin picking. I would look like I got chicken pox constantly. So yeah, I think everybody has something. It might be huge, it might be really small, but to that one person, it is a fact in their life that is making them do something. I think it just depends how big that gets. I think that's such a question.
Yeah, sorry. For you on the spot, I appreciate it. Yeah, the reason I ask is because I guess in our methodology, and obviously I'm just here trying to seek the truth, and as I do agree that like different things will work for different people, 100% agree. I think where I'm coming from with all of this is that the way that I've been taught with addiction is like, okay, so you've got something that you're trying to quit. Now you're gonna have urges, you're gonna have cravings because your brain has changed. So the neural pathways are addicted, and so there's always going to be a new reason that you want to engage. So with porn, for me, I found it really hard to quit for like many years, and then started to do quite a lot of internal work on myself, started to meditate a lot, did a lot of internal family systems, and it was really useful. I found it really good, and I probably would say that my frequency of use did drop. But then after a while, after doing a lot of that work, one day I was just like really horny, to be honest with you. So I'd be like hungover. Yeah, so I'd be hungover, I'd be horny, maybe just something that's come up, a bit stressful at work, little things. And it might not actually be related to like some big sort of issue in life, but then I'd go and look at porn because I didn't have a method to deal with those urges in those moments. And it's like the rational mind would just kind of switch off, and then I'm back in it again. So I guess that's what would happen for me. And what I've been taught is a method which helps you kind of go, okay, well, there's A and B. You can either choose to look at it, and that's going to lead to this, and this, and all the sort of reasons that you don't want to continue in this behaviour, but you are going to want to, and that's okay that you want to, because your brain's addicted at this point. Or you can not look at it, and that's going to lead to like maybe peace of mind, clarity, confidence, and just feeling better about yourself, and all these benefits. So you've got option A, option B. Now, outside of that, there's a million different ways in which the brain's going to try and get you to look at porn. And one way for me would be, well, I need to work on this little bit of my life a little bit more. Maybe it's some kind of trauma that I've yet to unpick, or some sort of thing going on in my life, like a little problem. And the addicted mind would kind of use that as a tool to get me to go and look at porn, because then after that sort of setback or relapse, whatever you want to call it, my brain could get, well, it's because I hadn't sorted that bit of my life out yet, or, oh, I've just learned this from that relapse. But what I now believe is that, well, you've got option A and option B, and all those other thoughts are just storylines, which are kind of irrelevant, because the reality is your brain's addicted and you want to stop, but you also want it as well. And I don't think you're going to get rid of that wanting. I think the wanting is going to stay. And I think all the trauma that you can kind of resolve maybe lead into the wanting, but there's loads of other reasons why you could have that wanting as well, if that makes sense.
Yeah, I think so. The key thing that stood out for me what you said is that you did the inner work and it did drop.
Yeah.
So I think we're both right in what I think we're sort of both on the same page, because I always used to say to clients, like, by the time you need a rehab, because obviously that's where I've worked, by the time you're in that sort of shape and you need that, you don't really have a choice anymore. But then you get sober, you get a detox, you do your inner work, you stop doing what you were doing, then you have a choice. Then the choice is then put back on you, which is kind of what you were saying. You have choice A, choice B, and it's your decision. So personally, I think you need to do it all.
Yeah.
And especially from where I'm coming from, in my line of work, I'm dealing with, okay, you've hit your rock bottom now. Like, you need the detox, you need the work, you need the deep work. Then it's about what you do after. That's a separate part of it. So I think for me, when I've had clients come to me, they may have done deep work. Sometimes it's not deep enough. I'm quite challenging in the way that I work. I'll push you and, we'll get there. Yeah. But some people find that quite difficult, and they're a bit like, whoa, okay. I'm like, yeah, like, we're going to go there. But yeah, so I always used to say, like, you've not really had a choice. You might have had an intervention, or, your husband might say, I'm going to leave you if you don't go to rehab. Like, the choice is almost taken away from you. There's other factors to that choice, let's put it that way. You come to rehab, you do the work, and it might take, a couple of weeks to sort of get out of that manipulative mindset of, I'm fine, I'm okay. And then after rehab, that's when you have the accountability, you have the responsibility, and you have the mindset to be like, okay, now it's my choice. Yeah. Am I going to let this trauma affect me and be my excuse for the rest of my life? And I think that's where it changes. It changes from a reason to an excuse after you've done that work. Because it's like me showing you the lie and you just ignore it. Yeah. It's like, I've opened up your mind. I've given you the understanding. I'm a big believer in self-awareness. Like, you have to have self-awareness in order to continue through your life making the right or correct or whatever choices. Don't really like using like good and bad and positive and negative words, but like, you've gone to rehab, you've done the work, or you've not gone to rehab and you've done the work, and you've got this self-awareness and understanding of, oh, okay, like, this is why I was using, this is why I saw myself in the way that I did and thought that my life was only ever going to be that. I don't want that anymore, so now I'm going to do something else. And then you have the choice, which is where your sort of method comes in, and the choice A, choice B. And I almost think that's a really good sort of add-on and a really good way of looking at like a sober coaching life, because that's a really difficult thing to do. I find that in my work, like, the sober coaching is the hardest part for me, because obviously I'm a therapist and I'm kind of so used to going, oh, there must be some unresolved trauma. Like, no, there isn't. It's just that you are now living a life where everything within you screams, oh, this bad thing's happened. Let's go and drink. Let's go and use. Let's go and do whatever. And you've got to try and ignore that. And that's really hard to do, especially if for 10, 15, 20 years, that has been the only thing that's ever got you out of, in your head, a tricky situation, a stressful situation, grief, whatever.
Yeah. mentioned the word choice there a few times, and I love that. And you said how sometimes people can have that choice taken away from them.
Yeah.
I think that's like such a integral part of what I've learned, is that's what happens in addiction, in my opinion, is that people feel like that choice is gone. Like they don't have a choice. So it's either, you quit, or that's kind of it, really. That's the only choice you got, is you got to quit.
Yeah.
So I think a lot of people, they want to quit, and they just focus on the wanting to quit. And that's why there's like whole communities of like NoFap, which is like a quitting porn community, but it's just focused on the quitting. But the problem with that is you can look at it if you want. So it denies the reality of freedom. You said there can be like all these different reasons to engage.
That bit goes back to like labels, like, okay, let's say that, so I had a client once. He was one of 3 brothers. And he was like, oh yeah, like my dad was really abusive. And like we did some work on that, and the work was needed. But I'm just going to take that example and kind of change it a little bit. But say if he had come to me and been like, I was a victim of child abuse. I don't like the word victim, because that immediately puts a negative connotation onto that word, onto you. So it's like, oh yeah, so that's my be all and end all. That's me. That's why I drink. But that isn't you. You're an adult. You've got your own children. That isn't you anymore. So that's where the choice comes in. You can either choose to continue to see yourself in that light, on that label, and have that label of I'm a victim, or you can choose to change that mentality. And yeah, it's super simple. It's a lot easier said than done. Of course it is. But ultimately, that is kind of what it comes down to. You either choose to continue this life of chaos, or you choose to change it.
Yeah.
And that was something that my mum said to me when I was about 16, and I was going through my own mental health issues. And she just turned around. She was like, at the end of the day, it's your choice. You either choose to stay how you are, or you choose to change. And that's all it is. And I think, when I was 16, I was like, she doesn't care about me, as any 16-year-old teenager would. But as I've grown up, actually, like, it's done me the world of good, because you can either let something completely derail your whole life, or you can deal with it. I'm not saying that you don't have to deal with it, but you have to deal with it and move on almost. And that might sound really like cold-hearted, but ultimately, you've got to change your life. You've got to quit the porn. You've got to quit the alcohol, quit the addiction,
Yeah, no, I totally agree, because that's the thing is, it's a choice, and you can continue down this one path, or you can go onto a different path. And in my opinion, that's kind of all there is to it. It can kind of become a lot more complicated when you think outside of those two choices. In terms of self-awareness, you talked quite a lot about, helping people become more self-aware. I think the thing that I really struggled with, which I needed to become more self-aware with, and, I've still got a lot to work on when it comes to this, is the self-awareness of actually how this was hurting my life as well. So I hadn't really been able to see that reality for such a long time. So I was kind of stuck going back, and because I had done quite a lot of internal healing work, and I had like a pretty decent job and relationships and friends and family, and life's pretty good as a whole. So because of that, whenever I kind of had like a relapse setback and I felt so bad after it, I couldn't really put things into perspective. I couldn't really understand or realise actually how much that was harming my life, because I had all this other good stuff sort of going on, and like outwardly seeming quite confident and had my like stuff together. It's like those relapses though, like some of those setbacks, like they would actually tear me apart. Like I would be, like the pain inside would be really, really, really bad, like pretty deep, and just be on my own, just feeling horrendous. And I think until working with Mary, as I say, like I hadn't actually realised how much it was harming my life, and how much it was preventing me from actually becoming the person I really wanted to become. I wonder if you do much on that in your work, or like actually helping people see like this is what's going on in your life, and this is the alternative route that you could take if you wanted.
Yeah, I guess that's kind of accountability, isn't it? Like, and I think everybody has to do that. And a lot of places do it very differently. I've been part of places that you do family therapy, and basically it's a Zoom call, and your family tell you the absolute chaos that you've caused them. And that can be really like, whoa.
That sounds brutal.
But for me, it was almost like a turning point. I mean, one of two things would happen. It would either be a complete like turning point, and the client would very much be like, oh, I'm really glad that they got the time to talk about that. Or you would find out that the client had completely lied to you and said that their addiction was not that bad. And then you get the family come on and they're like a completely different story, and you kind of sat there really awkwardly. Wow. So there's that part of it. But
so you were, how were you like involved in those family therapies?
So I was the therapist, and it's more about facilitating. It's not necessarily a traditional family therapy session. It's more, they would get kind of questions that they would have to think about. And then it would just be sort of a meeting. I would say, okay, we're here. I'd give them sort of a update of how they've been doing, and then I would kind of hand it over, and you kind of explain like, this can be quite intense, like don't worry, we've got time. And like I would just facilitate, hold the space really, rather than say too much. It wasn't really about me, it was about family members getting a say, because that's a massive part of addiction and recovery. Like the family don't get a say, and it's them that's been affected the most. And a lot of the time, we focus so much on the person who's going through it that we forget about the people that it's impacted. So it could be really beneficial for both sides, and really help sort of that post-treatment, like at least we know that they're going to be going home to somebody who has had that time to be able to talk about how it's affected them. But I know other rehabs, there's a place in America, I don't know the name, and it was somebody I follow on TikTok, I can't remember his name now, and he's in recovery, and he went to a rehab in America, and he was there for 12 months. It was just super intense, like 12 months. Yeah,
that's a long time.
And they would make you do like a list of all the things that you feel like guilt and shame about, and then they would make you read it out in a group, and if you didn't cry, you had to do the whole thing again until you cried, basically. Like, and it was really trying to get like no, that's not good enough, you need to go away and do it again because there's still more. That's very intense.
That's brutal.
That's very intense. But like, again, like it's so different. Like how you deal with your porn addiction is completely different to how the next person deals with theirs, and it will manifest in a completely different way as well. And the reasons behind it will be completely different. And I think that's why, I not struggle with, that's too harsh, but I don't believe that the 12 steps is the be all and end all. I don't, because it, yes, okay, it works for hundreds, thousands of people. It works, and great, good for them. But most of my clients don't go because they don't want to. They don't want to sit in a room and go, hi, I'm whoever I am and I'm an addict. They don't want to carry it around. They just want to leave it at the door. They've got clean. They've done what they need to do. And then they want to go and live their lives. They don't want to sit in a room and talk about what's triggered them that week, or how they dealt with this or that, or, whatever it is. And I think as a foundation or as an option, it's good. I like the program. I like sort of having that structure in it, but I don't think it's the be all and end all.
No, I don't at all. I mean, I'm watching this program, as I was saying before we recorded, called Louder Milk, and it's kind of about like 12 steps sort of style, sort of community groups in America. And I've got to admit, I find it so funny. I've just been watching too much of it. But at the same time, I can't really imagine too much worse than just sitting around in a room with guys who believe that they're addicted for life. I don't know, I just think it's so disempowering. And it's like, you can just change your brain and quit this permanently, and that's that, and then it's done, and then you just move on and start focusing on other stuff. I'm a big believer of where you focus, that's where like your life basically goes, like that's where your attention goes. So,
and I think for some people they need the label, and this is again going back to labels, and some people who do and some people who don't. Like, I've worked with people who they're okay with being an addict. They are fine with that, and they are happy to have that label and go to meetings, and that is part of their life and it's part of how they stay sober. I guess a question, a study to do along the way is like, it's someone who's been sober for 20 years, and goes to AA religiously. Could they stop and still be sober? Who knows? Because they won't do it, because that's where your risk comes in. Why would I risk not going to the thing that's kept me sober for 20 plus years? Why would I risk that?
Yeah, and also the thing on wanting that label, I'm not going to lie, this is going to probably upset a few people, but here we are.
Brace yourselves, guys. Strap in.
I do believe that some people actually want to stay in this problem.
Absolutely, I agree. I have had clients who want to stay in it. It is clear. They've been to 10 rehabs and it's never worked, and then they just keep coming back. And part of that is because rehabs are the only place that they feel loved. You can't go to rehab if you're not an addict.
Gotta admit, it's kind of hard to talk about because it's so close to the bone for me, but I really do think a part of me, it's probably subconscious because most things probably are, but a big part of me didn't want to face the reality that actually I could quit this, because if I did quit it, then I'm gonna.
You got left.
Oh yeah, and also just shit. Actually, I'm not where I want to be, because I kind of had this mindset of so many years of who I could be if I quit porn. But the truth is I don't know. I think since I was quite young, I had a little bit of a craving to make a bit of a success of my life, and never have, and maybe I never will. It's I think
a podcast. Be more confident in yourself. Come on.
Thank you. I think my definition of success has changed along the way, and now it's
Relenting standards.
Oh, absolutely. Might have to go for a therapy session after this.
I've got my therapy stance. Let's go.
Me and Andy, podcast host, talking about my unrelenting standards and always trying to achieve stupid amounts. But my definition of that has definitely changed a lot. And now I'm just focused on, try and make a bit of a positive impact on the world. Forget about money completely, forget about ego, status, and it's all stuff I just need to work on more, really. But yeah, point is, in the past it was if I quit porn, then I'll be able to achieve X, Y, Z. And so part of me didn't want to quit porn, because if I do, then I face the reality that actually I'm not going to be some super successful guy. I'm not going to be this or that, this.
You got the excuse there.
Yeah, I got an excuse.
I can't. I'm not successful because I'm addicted to porn.
Yeah, exactly. Even so many times I've been right, I'm going to stay in my 9 to 5 until I hit X amount of days without porn, and then I'll be in a good enough position to go leave my job and maybe go and do my business completely. It's mad. So
just go do it. Just do it.
I think that's the thing. Is honestly, you gotta just. I think what's helped me, overall, just the option A, option B, and getting clear on this was destroying my life. Let's get rid of it and just take it a bit more serious. That was the main thing. But then also actually just working on my life and not really thinking about the addiction much and not focusing on it too much. Other than when I'm having an urge, accept the urge, it's there. You're going to have some wanting, you're going to have some desire, that's cool. You accept it, you make your choice, you move on. Other than that, there's not really much use in thinking about it, in my opinion. It's just the urges only come now and then. Other than that, you just want to crack on and try and achieve what you want to achieve, and not get caught up in this idea that I can't achieve X until I've quit. Because you can achieve amazing things while addicted, but here's the thing, your mind's going to be free. I think for me, that's the other thing, is I'd rather have peace of mind and no addiction at all. Much rather have that than have an addiction and £1 million or a massive audience or any of that superficial stuff that I really just don't care about anymore.
Yeah, and I think along that same sort of strand, when you said, if I quit porn, and I went, oh, what would you have left? That's also a big thing, Some people, it's their best friend. I've literally had to do sessions on grieving a bottle of whatever because that is their best friend, and you've got to grieve it like it's a family member.
Yeah.
You know, you think you've had this one coping mechanism and it's so deeply ingrained in you that you cannot quit like on your own. So it runs so deep through your body, and you've done it through everything for 20 years. And then you just got to go, okay, I'm not going to do that anymore. Like, it is hard. Mm-hmm. There is a grieving process in it. And it might be a grieving a loved one in that sort of sense, or it might just be grieving that lifestyle, or it might just be as simple as just, okay, I've got to let that go, and I've got to come to terms with the change in my life, that I'm going to be able to achieve X, Y, and Z. And for example, like, you have to almost like come to terms with that. You're about to lose a huge part of your life. It's massive.
Do you not think that substance can sometimes be glamorized though in addiction recovery? Because like, talk about it being a best friend for some people, I think it's also worth pointing out, like, what is it actually giving people? What do you think it does give people?
That's a multi-layered question. I think it depends why the person does it. I've had people who it gives them confidence. It gives them peace of mind, weirdly enough. It gives them the ability to be successful. It can give a whole load of things. And I think, maybe it's about grieving what it gives you. Maybe if you can't achieve that without this chaotic life of substance abuse, then maybe you need to stop doing that life. Maybe you need to stop trying to achieve that, because clearly you can't do it without this substance. Maybe you can.
What if all those things that it's giving someone is just like temporary escape though from how they feel because they are addicted? So someone's addicted, they got this problem, they're always wanting something, they feel like they can't have it, and then eventually they get it, and now they're feeling good again because they've got the thing that they've been wanting, that they're feeling deprived of. Could that not just be like the only thing that they get?
I read Matthew Perry's book. Have you read it?
No, no.
It's really good. His memoir. Obviously, he was an addict.
You went to, how many times did he go to rehab? Like 100 times or something?
He's had 62 detoxes or something like that. And he made a real solid point, and it's throughout the whole thing, that he really wanted to be loved, like unconditionally loved. But every time he got into a relationship and it got towards being loved and sort of them sharing every part of themselves, he would end that relationship. Even though that's all he ever wanted, he would end that relationship because it's fear. Fear is amplified when you're in that addictive cycle. It's amplified anyway. Nobody wants to be vulnerable. But he was so terrified that they would, A, be able to see who he was, the real him, and B, that they'd see it and then he'd have to stop drinking and using. So then he'd end it. Even though it's everything that he ever wanted, he'd end it. And it's the self-sabotage.
Was he not just addicted though? And that was why, because he just wanted his substance, and then he used the desire for love and all of this stuff as a reason to keep on staying in the addiction.
I don't think you'll ever know the answer to that question.
I don't think we would. But yeah, I believe what goes on is that there's two different things. There's triggers and there's craving. I believe the emotional stuff is the trigger that creates a craving.
Right.
Now, I believe that for a lot of people, they're trying to reduce their triggers. And to reduce the trigger, they may do a lot of emotional work so that they don't feel stressed, anxious, like they're a failure, lonely, isolated, whatever it is. And I believe that's where most people approach addiction, is trying to reduce the triggers. And those triggers are always going to come from different things. So you can do all the emotional work, remove the trigger, but then you're still going to be left with craving. And so it's in those cravings that you have a choice. And that's why you need a way to deal with the craving. Like that's
tables have turned right now. I'm putting pressure on you.
I believe there's merit. There's merit in doing all that emotional work. Like, don't get me wrong, it's one of the most important things to do as a human being, is to go and like understand yourself better, have more self-awareness, understand why you are the way you are and how you can be a better human being.
Connect with yourself.
And connect with yourself.
Compassion.
Have compassion for yourself. 100%. Do all those things. However,
said that. Yeah,
I really do. I really do. I feel like just like life as a whole, though, like who you are as a human being and how you improve yourself and self-improvement is just like a separate thing from like the addicted neural pathways. And like with the addicted neural pathways, you can have a lot of people who, if they did just have a tool, like a way to deal with those urges in those moments, they wouldn't have anywhere near as many emotional problems, because the main emotional problem in their life is the fact that they don't know how to deal with the urge. So that's why I kind of see it as like, well, you can deal with the emotional stuff, but if the main emotional problem in your life is that you don't have the ability to deal with urges and you don't have the self-control because you've never been taught, that's what it is. It's like, well, let's just go and deal with the self-control and the discipline so that you can then feel more confident and in control of yourself and the feelings of success rather than feelings of failure. So that's kind of where I'm coming from.
It was interesting that you said remove the trigger.
I don't believe in removing the triggers. You can't because
it lives there.
There's always going to be new triggers as well.
Yeah, but in the emotional versus logical sense, you know, you said, you know, you go and you do the emotional work to remove your trigger, but you're not going to ever do that.
No.
It's not about removing the trigger. It's about understanding what it is and understanding how it impacted you emotionally.
I feel like I know quite well why I've ended up at porn in the past, but then what I don't understand is why would I look at porn when I'm like not even feeling that bad. So give you like an example. When I was living in Portugal, I was like feeling really, really good one day, and I was just like playing football, you know, out in the sun. I'm on this pitch and there's like a Playboy magazine on the floor. Just happens to be there. And back then I kind of was feeling good, but then, you know, I just look at it because there's like some good looking girls. And then I went home and I just went and like masturbated and looked at porn. So it's kind of that for me. It's like those moments where I am just like horny and there's like not really any emotional stuff going on. It's just craving. It's just, to me, that's just like addiction. I don't really see where like emotions come in with that. Like if back then I had a tool which was like go and read some content, like a very specific script, which is like option A, option B, then I would have been able to make a choice that's actually based on logic and rationale. So that's why I'm kind of reluctant to like some of the emotional stuff.
But you just said you're in a good mood.
So I was in a good mood then, yeah.
So you're still feeling emotion. You're in a happy place. And I think, I mean, I don't know if I've got that right, but because you said, I was in a good mood and I don't know why I did it. But you can do it good or bad.
So what?
It doesn't have to be like this deep, dark thing. I had a client who loved it. Absolutely loved sniffing cocaine off his nose. Loved it. Brought him so much joy. Did it when he was happy, did it when he was sad, whatever. It's not, like, you can do it when you're feeling joy. Those are also like...
What's like the purpose then of doing like the emotional work?
That reconnection.
With what? With yourself. So that you can then do what if you have an urge? Because in my opinion, I just think the urges are going to come. Whether you've done emotional connection or not, I just think you're going to have urges if your brain's addicted.
But then, so for you, you were having a good time playing football and there just so happened to be the magazine on the floor.
Yeah.
That triggered it.
Yeah, that was the trigger.
Yeah. So it wasn't necessarily a craving that just came out of nowhere.
No.
And I think that's where, you know, I said earlier, we're trying to put logic to an emotional issue. It's not necessarily about doing emotional work and getting it all out, although I'm a big advocate for that. But also, there is no logical answer to addiction. You could be walking down the street and then there's a Playboy magazine on the floor. Oh shit, I've relapsed. You know, like, that's not logical.
But
because you still have the choice.
If you...
But you might not always pick that. You might not always pick the right choice, you know.
I don't know.
Quotation marks.
I kind of just think like back then I didn't really feel like I did have a choice. Like it kind of felt like, well, trigger, automatically go and look at porn. There wasn't really like this choice of like, okay, what do I do now? And I didn't know the choice because my brain was addicted. So I didn't know that the option A is like this horrible list of stuff I don't want, and the option B is all the stuff I don't want.
But surely subconsciously you would have.
Yeah, subconsciously I would have done, but it's bringing that subconscious into the conscious, which I think is the most important part. Because I think when you're having that urge, you have no real awareness of like the consequences of what's going to happen if you actually act on that urge. And I think you need to have awareness of the consequence. And I think that awareness is...
And having that awareness will
help you
bring emotions into it. You can't be aware of all of the terrible things that are happening without feeling it.
Yeah,
and I think that's the difference. Like, I think it's not about one or the other, it's about both. You have a logical solution that works for you, it's working for you, and that's absolutely amazing. But all of those terrible things on that list, I don't know what they are, but do you read them and feel anything?
Yeah, definitely. Yeah.
Emotional.
No, you are right. It is emotional because like the list will have like things like, right, it's a list of feelings. That's what it is. So yeah, you are right. You are right. Like the list will have things like, right, I'm gonna feel shame. I'm gonna feel upset with myself. I'm gonna feel like a failure. I'm gonna feel weak. I'm gonna feel drained. I'm gonna feel tired. I'm gonna feel low in confidence. I'm gonna feel lonely. You know, the list is horrible. It's a list of emotions, and to really like make the right choice in that moment, I have to feel those emotions to go, okay, well, option A, I want to feel all of that, and then option B is like the list of things that I do want to feel, which is like energized, excited, confident, happy, connected, shame-free, you know, feelings of integrity and honesty, commitment to myself, loyalty, and so it's like feeling all of those feelings. So you're right, it does bring up some feelings. I guess where I disagree is going back in time to kind of resolve traumas and stuff. I don't know, I'm kind of the perspective that stuff's amazing and that everyone should do that stuff, but I don't really see how that's related to quitting an addiction, because in my opinion it's only those urges that you need to make a rational choice based on the feelings that matter, like whether you do it or not, like what feelings are going to come up if you do it, what feelings are going to come up if you don't do it. That's where I'm at.
Okay, interesting.
So we're probably meeting in the middle somewhere there. Yeah. Thanks so much for coming on. I really do appreciate it.
Thanks for having me.
And honestly, I really do think and hope this will help one or two people. Where can people find you?
So it's jmwtherapeuticservices.co.uk.
Awesome.
That's me.
Get in touch with Jess if you want to join me and have some therapy.
Yeah, have some challenging therapy about all your emotions.
Oh, yeah. All right. Thanks a lot for watching or listening. And I hope you've enjoyed the podcast, and I hope you have an amazing rest of your day. Goodbye.
Bye.